Good morning, everyone.
Good morning.
I am Dr. Bishop, a vascular surgeon, and also the chairperson of this meeting. Now, I would like to begin by introducing the members of this group. So, firstly, we have Dr. Alexander, who is a general practitioner, Dr. Ali, GIT specialist, and Ms. Arjun, who is the pharmacist dealing with this case. We'll also be joined by Professor Nutmeg. This professor, she could not have been here today since she's out of the country doing various epidemiological studies. So, she will join us via telephone and discuss the case dealing with diverticulosis. So now that everyone is formally introduced, I would like to discuss why we are out here today. Right? So we all know that we are dealing with a case with Mr. Grey Goose, 93-year-old African-American male. Now, I would like to remind each and every one of you that this is a serious matter, and the rest of the events will take place in a chronological order and also be serious. Okay? Okay, so I think it's Dr. Alexander. She had the first encounter with this patient.
Yeah.
So Dr. Alexander, would you mind enlightening us?
Sure. Good morning, everyone.
Good morning.
Well, Mr. Grey Goose came to me on the 14th of January this year, complaining of abdominal pain, cramping, and nausea. On taking his general history, I discovered that he drinks 60 ounces of vodka every day and quit smoking about 50 years ago. He has 60 ounces. Upon physically examining the patient, I found that Mr. Goose was in no apparent distress and his vital signs were stable. His past medical history revealed that he had a deep vein thrombosis about 10 years ago, and he's been on Coumadin since then. And so by his symptoms, I diagnosed peptic ulcer, and I prescribed antacids and sent him to the pharmacy.
Yes, he did come to the pharmacy, and on that day I was the only pharmacist present.
All right, well, Ms. Arjun, continue. Enlighten us about the situation, please.
But before I talk about the antacids, I'd like to comment on the use of alcohol while using Coumadin. Coumadin, as we all know, is a blood thinner, and as a drug, it has many side effects, such as nausea, vomiting, and stomach pain. All of these are symptoms that Mr. Goose exhibits. Also, a number of studies showed that these symptoms are increased with the use of alcohol.
So you're trying to say that our patient didn't have peptic ulcers,
Yeah.
but could have just been experiencing the effects of Coumadin?
Yeah.
Well, Dr. Alexander, would you like to still continue about your diagnosis and enlighten us about his peptic ulcers?
Well, didn't think the Coumadin had anything to do with it, because alcohol has shown, well, it has been shown that alcohol can irritate the stomach by increasing the production of acid, which will worsen the symptoms of the ulcer. And studies have also shown that the prevalence of peptic ulcer increases with age, so I didn't really consider the Coumadin.
So you didn't do any diagnostic tests or anything, any confirmatory tests at all?
No, I didn't think they were necessary.
Well, Ms. Arjun, you were enlightening us about something earlier. Would you mind continuing about this?
Well, when he came to the pharmacy, he told me he had peptic ulcers. The doctor prescribed antacids, so I sold him Pepto-Bismol. A few days later, he came back for something stronger, and I sold him Rolaids, which is more effective. But as I'm listening to the case, I realized that the antacids did not work because he didn't have peptic ulcers.
You know what? I think I agree with Ms. Arjun.
Dr. Ali, this is a really interesting agreement of yours. Would you like enlightening us? Please tell us more about this.
Of course. Well, Mr. Grey Goose came to me approximately a month ago, and he come because his daughter told him to visit me. His daughter requested that he visit. So he told me about his previous encounters and treatment he had undertaken. So I decided to do a confirmatory test for peptic ulcers. I did an esophagogastroduodenoscopy scan, and the results came out negative. He did not have peptic ulcers. So this was really surprising to me because, as Dr. Alexander said, he drinks 60 ounces of vodka every day. This was really surprising that he did not have peptic ulcers.
Well, I also know that you did some other confirmatory tests. So if you did, continue please.
Okay, no problem. After confirming that he did not have peptic ulcers, I carried out a computed tomography scan, and the results were just as I had expected. An abdominal aortic aneurysm, approximately 8 cm long, present in the lower abdomen, anterior to the spinal cord. And I'd also like to add that the symptoms experienced by this patient is also symptoms of aortic aneurysm. So since this is Dr. Bridgel's specialty, I would like him to continue explaining my results.
Alright. Well, when this patient came to me, I did some CT scans in order to confirm this. So I'll start basically. Now this image generated, this image here shows the normal abdomen without the aortic aneurysm. Right? Now the second image generated. This image here shows a large mass anterior to the spine. This large mass is the aortic abdominal aneurysm within Mr. Bruce's lower abdomen. Also, this is just an enlarged view of the aortic aneurysm. So this basically shows it is not confirmed that this aneurysm is leaking. However, the black arrow here suggests that there are some unusual substances present.
Okay, so the unusual substances may not be because the aneurysm is leaking.
Well, we need some other confirmatory tests in order for me to diagnose that. Now, final image, burst of color, epic color here as you can see. Now this basically here shows the pressure differences within the aneurysm. So the superior and inferior parts, represented by the red colors, basically show that these are the points of highest pressure. So the points of highest pressure, basically this will be the points of rupture. So this is all the images that I have taken with the patient. But before I hand over to Dr.
Wait, there's
Ali,
more?
yes, there are a lot more to this case. So there are some remarkable findings that Dr. Ali also did in a CT scan. So as I was saying before, due to the size of this aneurysm, there's a 75% chance that this aneurysm is likely to rupture. That is 75% chance, but when this ruptures, there's a chance of hemodynamic collapse, which will lead to death.
So this means that this problem needs to be attended to immediately. Well, as said before, there were further discoveries. Lower abdominal CT scans showed small pouches bulging out of the lower colon.
Are you saying that Mr. Bruce has diverticulosis?
Yes. And the diverticulum may also be infected. I also have some images present here.
Sure.
Okay, so this first image here shows a CT scan of the lower abdomen. As you can see, there are black patches here on the lower colon. These are representative of diverticulum.
Would you like me to hold them?
Thank you. The next image is a cartoon image showing the origin of the diverticulum. As you can see, they start from the inner wall of the colon and extend outwards. And they also contain fluid inside them.
So this image shows diverticulitis.
Yeah, well, if the diverticula are infected, they can represent diverticulitis. And finally, this is a radiography scan conducted with barium sulfate. And as you can see, the arrows point to bulges on the sigmoid colon. These are also representative of diverticula.
So he has diverticulosis and possibly diverticulitis, which means he has diverticular disease.
You are quite correct, he might have diverticular disease. There were also some fluid density lesions present in both kidneys, which are likely to represent bilateral renal cysts, which would be confirmed by ultrasound, but these are the lesser of our problems right now.
So what you all think before we treating this?
Before we move to treatment, right, it's necessary that we summarize what we have discovered here today. So Mr. Virgus is a 93-year-old African-American male with a large aortic abdominal aneurysm. He also has diverticulosis and possibly diverticulitis. So he has no signs of peptic ulcers as confirmed by Ms. Arjun, and he was just basically experiencing the effects of Coumadin and the aortic aneurysm. So we have two complications here to deal with. We have the aneurysm and the diverticulosis. So I think it's only appropriate for us to discuss the aortic aneurysm.
Yeah.
So does anyone have any?
I say we do
idea?
surgery.
Surgery?
Insert a synthetic Dacron graft.
No, I disagree. Open repair surgery sounds better than the dark one.
Wait. I'll forgetting that this patient is on Coumadin. We cannot risk having a surgery with this patient. I believe that conservative methods will be the appropriate treatment plan in this situation.
Probably beta blockers or angiotensin converting enzyme inhibitors can be used.
Beta blockers?
Yes, you could use those. These can prevent the aneurysm from rupturing by lowering the blood pressure and reducing the stress on the arterial wall.
or maybe we can just initiate a diet plan which does not include alcohol.
Now, those are all really good suggestions, right? But I think it would be the right time that we call Professor Nutmeg in order to get her opinions on the dietary needs for this patient. So I'll be making the call now. I'm just taking another line.
Good morning.
Good morning, Professor Nutmeg. This is Dr. Bridgewell. I'm here with several of my colleagues, and we are discussing possible treatment options dealing with the case of Mr. Grey Goose. Now, I would really like if you can help us out determine the possible treatment plans dealing with his diet.
So, good morning, everyone. I read the case email and well, that particular is formed when Preston Bill only 4 boy, wait. Well, that particular is formed when Preston built up his side colon wall. Usually because of constipation. The most likely cause of this is a low... Hold on! Sorry about that. The most likely cause for this is a low fiber diet because it increases constipation and pressure inside the colon. I think that Mr. Goose should be started on a high fiber diet.
What fiber sources would you recommend, Professor Nutmeg?
Fiber intake can be increased by eating whole grain bread and cereal. Fruits like apples and pears, vegetables like peas, spinach and squash, and starchy vegetables like kidney and black beans.
Right, thank you very much, Professor Nutmeg. You have been a great help. Please enjoy the rest of your day. Now that we have just heard from Professor Nutmeg, does anyone have any other further questions? All right, well, to conclude, I think it's necessary that we also summarize the treatment plans discussed earlier. So, we agreed to conservative treatment plans, like beta blockers, and basically to constantly monitor the aortic aneurysm, and also we said a diet high in fiber, also to treat the diverticulosis. And finally, you said something about the renal cysts.
Yes.
So I think we will need an ultrasound to confirm this.
Dr. Bridgewell, would you like me to inform Mr. Goose and his family about
No, that's fine. I would bring the news to them. Thank you all again for being here, and I would really like to let you all know that your contributions were greatly appreciated. Thank you all very much.